Hi, my name is Adam Edwards, and I'll be presenting my infographic on my third paper, which discusses recommendations for defense lawyers representing youth charged with multiple criminal offenses, otherwise known as chronic youth offenders. The overall purpose of this presentation is to offer a guideline for defense lawyers during different stages of a chronic youth offender's contact with the justice system. This paper highlights two main issues: the gap between developmental research and legal practice, and developmentally inappropriate representation leading to unfair outcomes. Understanding these gaps is essential because they shape not only how we think about youth offending, but also how we respond to it in a legal context. To begin laying the foundation for these recommendations, it is important to define who we are talking about and why that matters. Crucially, we have to define chronic youth offenders in a broader context to allow defense lawyers to apply the recommendations in an operationalized way. Obviously, chronic youth offenders are adolescents charged with multiple offenses, so stopping recidivism is the primary goal. However, to do that, we have to expand the definition to account for developmental vulnerabilities, impulse control issues, inconsistent decision-making, a history of trauma, neurodivergence, and unstable living and family dynamics. When we take a step back and consider all of these intersecting factors, we start to see why these youth require legal strategies that differ from those used with adults or even first-time youth offenders. All of these factors, when put together, contribute to the difficult path chronic youth offenders have when they navigate the justice system. With this broader understanding in mind, we can now consider the multiple roles defense lawyers must play when supporting these youth. I previously mentioned that the defense lawyer must assist the youth during different stages of the youth's contact with the justice system. It may be a perplexing thought, as defense lawyers are typically believed to play only one role: prove innocence. However, that does not fully capture the importance of defense lawyers towards chronic youth offenders and their rehabilitation, as they serve not only as their defender, but their advisor, advocate, and rights protector. These roles are not merely labels. They reflect the fundamentally relational and developmental nature of representing youth. These different roles ensure that their clients receive fair treatment that is centered around YCGA principles of rehabilitation rather than punishment, and defense lawyers also have to coordinate with parents and social workers who may not always have the youth's best interests in mind. A further role that defense lawyers must have is ensuring that unconstitutional outcomes like indeterminate sentences and adult-oriented sentences are denied. Taking these all together, we can see that the defense lawyer's responsibilities extend far beyond the courtroom and require ongoing, thoughtful engagement. Before any of these roles can be carried out effectively, defense lawyers must first develop a thorough understanding of their client. They need to understand both internal and external factors that cause them to gain a history of wrongful conduct. These internal factors include their cognitive ability, comprehension, and decision-making ability, which, if unaddressed, can lead to vulnerability and suggestibility during interrogations. Youth often struggle to process information under stress, and misunderstandings at this stage can shape the entire trajectory of a case. Lawyers also need to know general symptoms for specific mental illnesses to recommend their client to a mental health screening when required. Many of these internal limitations are caused by external factors. These external factors include personal factors like guardianship, parental substance abuse, peer influence, and gang affiliations. External educational factors like attendance, engagement, and quality of education are also contributing factors to chronic youth offending. When taken all together, these influences show us that chronic youth offending is rarely the result of a single choice or a single moment, but rather the product of a long-term developmental and environmental challenges. Both external and internal factors impact a youth's ability to understand rights, and addressing these issues can protect the youth from unfair outcomes. Only after establishing this baseline understanding can we turn to the recommendations themselves. Now that we've defined the population, highlighted the roles of a defense lawyer, and discussed what they should know beforehand, we will now look at the different recommendation strategies that I have proposed that all revolve around different points of contact within the justice system. These stages help organize the recommendations into a clear, practical framework for lawyers working with this population. The first point of contact is intake, which is a critical period for establishing rapport and assessing needs. Intake is an important period as it is your first real interaction with your client. Defense lawyers should follow a structured intake that assesses cognitive, developmental, and relational deficits and should screen for mental illness as needed based on their symptoms. The defense lawyer should ensure they use developmentally appropriate language to explain the process to ensure the best comprehension outcome during the legal process. This step cannot be overstated. If the youth does not fully understand what is happening from the start, the entire legal process becomes significantly more complicated for every party involved. The defense lawyer should develop restorative and collaborative approaches alongside the youth to prioritize long-term positive change, and if necessary, the defense lawyer should also incorporate any culturally relevant considerations into their consultation. Doing so not only builds trust, but also acknowledges the broader social and cultural factors that shape the youth's experiences. Moving from intake to the interrogation stage, defense lawyers must consider how to protect the youth's rights during questioning. The second set of recommendations involve interrogations, specifically interrogation safeguards to protect the youth's rights. A defense lawyer should implement procedural safeguards like capacity assessment, informed consent training, and documented waivers. This protects youth as they often unintentionally waive their rights without understanding the consequences of their decisions. The defense lawyer should also limit parental involvement, as according to an empirical study done in 2013, this often harms the youth's best interests. Parents, even with good intentions, can unintentionally worsen the pressure placed upon the youth. Think of a time you were punished in elementary school, or preschool, or high school. Your parents were likely on the side of the principal, and for good reason most likely. However, the defense lawyer's job is to prove innocence, and if the youth's parents take the side of the coercive interrogator, even in a small way, this can be detrimental to the youth, placing them in a vulnerable position that not only impacts their legal outcome, but their family dynamic. Interrogations, therefore, must be handled with tremendous care to prevent misunderstanding, coerced statements, or emotional distress. Therefore, removing parents from this process allows for the client to be protected from vulnerability, suggestibility, and misunderstanding. Finally, once the trial has concluded, defense lawyers still play an important role in supporting the youth. The final set of recommendations discusses post-trial support for the youth. This ensures that the dispositions made are being upheld while simultaneously remaining dynamic to accommodate for the malleability of youth maturity. Youth are constantly changing, and their needs today may not be the same needs they have a few months from now. If the current program is no longer effective for the youth, the defense lawyer should coordinate a revised and developmentally appropriate plan to guarantee the youth is receiving the best support possible in the hopes of having them never be their client again. This long-term view is essential for preventing future contact with the justice system. Despite the strength and belief I have in these recommendations, it is important to recognize their limitations. The recommendations are based on empirical evidence, but their implementation is purely conceptual and not empirically tested. For effective implementation, there needs to be community cooperation, support, and adequate resources. There also needs to be a lot of trial and error, as these are the first draft for recommendations of this type for defense lawyers. These recommendations also assume that criminal justice practitioners and policymakers support developmental reforms, which unfortunately cannot be presumed and rather can be assumed otherwise. This highlights the broader systemic challenges that extend beyond the individual defense lawyer's role. Looking ahead, however, future research and policy reforms offer meaningful opportunities for progress. By integrating developmental science into legal education and studying the different effects of intake, comprehension, and monitoring on recidivism rates, policymakers will gain a better understanding for the interventions required to best suit chronic youth offenders. Further funding is needed for interdisciplinary collaboration between legal and mental health professionals to encourage a more collaborative effort. Ultimately, ongoing research and policy change will determine how effectively these ideas and others like them can be translated into real-world practice.